other exemption issues. There are a lot of elements of the ACA that we know that VITA sites are, in particular, need to be paying attention to, but I think it's good for all community action agencies to be up to speed as much as possible about what's going on with the Affordable Care Act. So today's webinar, we're pleased to be joined by Stefanie Costello. Stefanie's been working with us probably now for a couple of years, I want to say, as the ACA has ramped up and has gone out, and we worked with her last year also during tax time on some issues as well to make sure our network is well informed, has the best up-to-date information. Stefanie is a health insurance specialist at the Center for Medicaid and Medicare Services over at HHS, and we've been working very closely with CMS on the rollout of ACA. So with that, I'm going to turn it over to you, Stefanie, while I step off camera. And again, enjoy today's webinar. Please make sure to put your questions in the Q&A box. So thank you for being with us.
Thank you. Let me go and get started. I know I have a lot to cover today, and I want to make sure to provide time for questions and answers and make sure that going over everything in enough detail for y'all. So thank you for joining me today. I want to start off by saying a couple housekeeping tips. Again, you can put your question and answers in the box, and we'll take those at the end of the webinar. Also, you'll notice there's a date on all of the slides that says January 2016. That's because this information was correct as of January 2016, and so we at CMS like to keep all of our materials dated that way, which is why it doesn't have today's date necessarily on it. This is an informational webinar for y'all. This is not intended for the press. If press are on the line, we ask that you email press@cms.hhs.gov if you have any questions. So to begin, we're going to go over the objectives of today's session. The first thing I want to cover is to make sure everyone understands what the minimal essential coverage is and how that impacts their tax filing, what to expect at tax time, a little bit in depth into 1095As. We're going to talk about the exemptions and the new exemption application. Then we're going to talk about paying the fee and some resources for y'all. So the first slide here, it's kind of an easy slide for y'all to visualize the three different buckets that folks are going to be put into really at tax time. So the first one are individuals who have minimal essential coverage, and these are folks who are already covered, and they're not going to need to do anything necessarily extra unless they get a 1095A. The second one, if you don't have coverage, you might have to apply for an exemption, and we're going to talk about that from the shared responsibility fee. So that's going to be the next group of folks. And then the third group of folks is going to be those that pay the fee. So if you don't have coverage and you don't have an exemption, then the third piece is going to be your fee. So that's where the three groups that you're going to probably run into. The next slide is what is minimal essential coverage. And basically this is what the ACA defines. We might here refer to as NEC for minimal essential coverage. And this is going to include any employer-sponsored coverage, so if you have coverage through your employer, individual coverage, this outside the marketplace coverage. If you have Medicare Part A and Medicare Advantage plans, so those 65 and older who have Medicare A or Advantage, most Medicaid coverage, so the low-income coverage, the Children's Health Insurance Program, and certain Veterans Health Programs are minimal essential coverage. In addition, some other ones that y'all might end up touching at your organization are TRICARE, which are going to be the Veterans Peace Corps volunteers. There's going to be people in the non-appropriated fund health benefits. If you serve refugees and you're on the refugee medical assistance, self-funded health coverage offered to students at universities, state high-risk pools, and then there might be some other coverages recognized by HHS. But all of those fall into the minimal essential coverage. I wanted to touch a little bit on Medicaid expansion just because this is kind of an ever-changing thing as different states come into the market. But again, Medicaid is considered minimal essential coverage. And what the Affordable Care Act did was it expanded Medicaid for certain age groups. So what it did was it expanded Medicaid for ages 19 to 64 if you fell under 133% of the federal poverty line, and then also former foster care groups and optional eligibility for individuals with income above 133 if those are folks under 65. So it expanded it. There's a 12-month eligibility period for most adults and parents and children, and then it also streamlined the application process. So I put up this new map. This is updated from Kaiser as of January 2016. And right now there are 32 states, including the District of Columbia, that have expanded Medicaid. And the newest one was Louisiana. It expanded it. I believe their enrollment's going to start sometime this summer. So if you're in Louisiana, you serve Medicaid eligible folks, you might want to keep your eyes and ears open for new information about enrollment around Medicaid in Louisiana. There's also 3 states right now who are under discussion about adopting different forms of Medicaid expansion. Those are Wyoming, South Dakota, and Virginia, so keep aware of those. And then the states in orange are the ones that have not yet expanded Medicaid at this time, and that's 16 states. So overall, we're doing pretty good and getting a few more every year. With the next slide is a little bit about something that's new this year with the Affordable Care Act, and that is a new form that some people might be receiving. You might have received one, and that could be the 1095B or the 1095C. So those individuals who have Medicaid or Medicare, or they have health insurance through their employer, they're going to be receiving a form in the mail. You might have already received it, 1095B or C, and this is coming from your employer, your insurance company, or maybe a state program like Medicaid, or from the federal government like Medicare. And this is something that just says that you will document your health insurance for 2015. You will want to keep this in a safe place. You do not need to file it with your taxes. If someone comes in to have their taxes prepared and they have the B or C with them, they can just keep that in their tax records, which they should do, but it does not need to be attached to the tax form. The IRS has more information about it. What you need to know is if someone has a B or a C, then they're simply going to just check the box, which if you look at the next slide, we have a sample of what that looks like. So for non-marketplace coverage, you get a B or a C in the mail, employer, Medicaid, Medicare, you're just going to check this box, so it's the same as last year. We want to make sure people understand that message. But for those people who have marketplace coverage, what we found is that even though last year people were signing up for the health coverage and had health coverage for the first time, they were still confused about what they needed to do at tax time. And we know that in 2015, a lot of new people came on to into the Affordable Care Act and into the marketplace. So this year we have 2 groups of folks who are going to be filing their taxes. One who might have filed and reconciled their premium tax credit, their advanced premium tax credit last year, and those who are doing so for the first time. So people might be on different levels, and you're going to want to walk through all your consumers and make sure they understand. So this is just a little visual right here. When they come through the door, you're going to have to help people make that connection between the premium tax credit and filing their taxes. And that's what we're going to talk a little bit about next. So what is the premium tax credit? Well, the premium tax credit is basically what an individual receives from the government as a discount on their health insurance. And this is given so that they can help purchase health insurance marketplace. So, marketplace insurance. So if they are in the marketplace and they are between 100 and 400% of the federal poverty line, they might have this premium tax credit. And they can choose to have an advanced portion of this, and what happens if they have the advanced portion of the premium tax credit, which you might know as APTC, is it actually applies directly to their premium. It goes to their insurance company, and then at the end of the year, we have to reconcile their advanced premium tax credit with what their tax credit actually was. is when you enrolled in health insurance for 2015, you actually enrolled most likely in the fall of 2014 or early 2015, and you estimated what your income was going to be for 2015. So now that you are going to file your taxes, you're going to have your actual income for 2015, and you're going to have your advanced premium tax credit, and you have to reconcile those. So ways to use your premium tax credit, again, you can use it as the advanced premium tax credit where it's paid directly to the plan, to the consumer's plan, and then they can take some or all of that, and then they could also choose to give it later. So they could choose to pay their premiums in the full amount and then go back, and when they file their taxes, they get all of their premium tax credit at the time they file their taxes. So you can choose it to be spread advanced across 12 months or get it at the end of the year when you file your taxes. So just some basic differences of these, and this is a really helpful slide. When it's determined, the advanced premium tax credit is when you submit your marketplace application, again, based on your estimated income. And the premium tax credit is with the submission of your federal tax return when you have your final income. The marketplace makes the determination for the APTC, and the IRS makes the determination for your PTC. How it's calculated, again, APTC is estimated in household income, PTC is your actual household income. And who receives it? Your APTC, the issuer. If you do the PTC, the consumer gets that at tax time. And when it's paid, again, the APTC is in advance across 12 months. And if you're doing the PTC, it is when the consumer files their taxes. So if you're getting the APTC, this is what the form will look like. I'm not going to go into a lot of depth here, but we do have some additional information on our website if you want some additional training on how to read a 1095A and going more in depth. But basically, this is what it's going to look like. All of the 1095As have been mailed out for the FFM states. Those are the federally funded marketplace states. And there might be a few states that had some issues. I know Minnesota posted information on their website that said they should have their forms mailed by the middle of the month. If you have a consumer who's not received it, received their 1095A and they think they should have, then they should contact their state-based marketplace or their federally, or the healthcare.gov to ask for the copy. The copy should come in the mail, and then they're also able to get it online, so they can go to their healthcare.gov account if they're in a federally facilitated marketplace, and they can download the 1095A there. And their 1095A from 2014 is also going to be in their account. So if they need copies of this, they've lost it, or they need a reprint, again, you can call healthcare.gov to get a reprint or a copy. If corrections need to be made, then that's how you can do that as well, by contacting healthcare.gov or your state-based marketplace. So the advanced premium tax credit, when we reconcile it, this is a helpful slide for y'all to help communicate this piece to the consumers, what actually happens during the reconciliation process at tax time. So the way you can, explain it to folks is that they have their advanced premium tax credit, which again was based on their estimated income for 2015, and now that we have their actual income and we know what the premium tax credit is for 2015, we have to compare those two. So if the consumer's advanced premium tax credit was less than the premium tax credit, then their refund will increase. They'll get money back, or the amount of taxes that they owed, if they owe taxes, would be lowered. Now, if the APTC was greater than the PTC, then the difference will increase, and they might have to owe money back, and then their balance, their refund will be smaller, and they might owe back more to the government if they already owe taxes. And this is an important thing to come across to folks because which we'll talk about in just a moment on the next slide, is about updating your income, but people are estimating their income for 2015, and that was difficult. So if somebody estimated that they were going to make $60,000 in 2015, and in reality they made $50,000, well, they're going to get money back because they they overestimated what their income was. But for those individuals who underestimated their income, suppose they said they were going to make $50,000 and they made $60,000, then they're going to end up owing money back. And we don't want a lot of folks to have to owe money back, especially if they're, if they are low to middle income. and we want them to be able to have, their refunds like they're expecting. So in case you have consumers who end up having to owe money back, it's because they didn't update their application during the year, and that they didn't keep their estimated income estimates up. So if you look at the next slide, it's really important to make sure that you are reporting all changes to the marketplace. And when you have a change in your income, or you have a change in your family size, or you move a state, different things like this, you need to call the health insurance marketplace or go to healthcare.gov and update your records. So if you think you're actually making more money, then you're going to need to update that. They're going to adjust the advanced premium tax credit for you based off of your new income or your new household size or whatever your situation was. And then that will help make your tax return more accurate when the reconciliation process happens at the end of the year. So even when you're filing folks' taxes this year, if you notice that their estimates were off in 2015, you might want to remind them, hey, did you use the same number for 2016's estimates? If you did, you might want to call healthcare.gov and get that corrected for this year so that you don't run into the problem next year. So it's a little bit of a teachable moment for them as well. Again, they can just call healthcare.gov and get that updated. But we definitely want everything updated throughout the year. So the next piece which you might run into with some individuals is if you have an individual who had marketplace coverage in 2014 but did not file their taxes, and they also had marketplace coverage in 2015 and subsequently in 2016, what's going to happen is their advanced premium tax credit for 2016 is going to disappear. They're just going to stop until they file their 2014 taxes and they reconcile those the taxes from last year. So part of the law says you have to file your taxes when you get the advanced premium tax credit. So if you run into consumers and they've lost their advanced premium tax credit, they didn't file in 2014, we need them to go back and file for 2014 and reconcile those. There is a special enrollment period that was just announced last week. So for those individuals who lost their APTC and didn't reconcile, as soon as they file their taxes for 2014, they'll be able to re-enroll in the marketplace. So we want to make sure that those last few folks are able to get in. So the next thing we're going to talk about is exemptions. We've talked about having minimal essential coverage, what to do. Again, most people are just going to check the box. If you get a 1095A, you're going to use that to reconcile your taxes. If you didn't have health coverage, you might qualify for an exemption. So who is eligible for an exemption? Well, there's different types of exemption categories. So if you look at the next slide, we have the different types basically are if you can't afford health coverage, which is for folks who the health coverage is greater than 8.5% of the household. If you were to experience hardships, and I'm going to talk about that in just a moment, that is an exemption. If you're not lawfully present in the U.S. is an exemption. Incarcerated during coverage years, an exemption. Experience short coverage gap, that means you might not have had coverage for 1 or 2 months. So for example, in 2015, you might have registered for the health insurance marketplace in February, which meant you didn't have health insurance in January. That would have been considered a short gap of coverage. You could be a member of a federally recognized tribe or a health care sharing ministry or a religious sect that objects to insurance. If your household income is below the tax filing threshold, then that is also an exemption, and IRS will determine what that threshold is. Or if you're eligible for care and Indian health care provider services. So those are kind of like our big buckets. Some of the exemptions can be filed with the IRS. So you might remember from last year, some of these exemptions you could apply for right on the tax return, but some have to be applied for through the marketplace, and some can actually be both. If they go through the IRS, they have to complete Form 8965, and if they go through the marketplace, they need to go to healthcare.gov with exemptions to get an application, and then they'll mail that in, and we'll talk a little bit more about that. So what we've done now is we put together this chart to help y'all out. It's 2 pages, but just to show you the first slide deck here is that the first column is the exemption type, and then the second column are those that are only granted by the marketplace. The second, they might be granted, or they may be granted by the marketplace or the tax return by the IRS, and the last one is just on your tax return. So this kind of gives you an at-a-glance look. And in just a little bit, we're going to talk specifically about the hardship and the marketplace applications and what you need to do with those. But the next slide talks a lot about, has the visual of the IRS exemption. And so this is kind of a handy one if folks don't know exactly where they need to apply for an exemption or how to do it. This is a great tool. So if we're going to be applying for them through the marketplace, you actually have to complete an application and submit it by mail. And this can be done at any time of the year, so just keep that in mind as you're working with clients throughout the year and you have folks that might be experiencing a hardship in May or June. You can go ahead and apply for the hardship exemption at that time. You don't have to wait till tax time. When you fill out the application, you need to print it and submit documents if necessary, and then you're going to send it to this address, and then they will determine what is eligible, if it's an eligible exemption, and then they will send you what's called an exemption certificate number. So you might have folks come through that have the exemption certificate numbers from last year, and some might be wanting to apply for one this year. Some of the exemption certificate numbers, those in federally recognized tribes or healthcare, the sharing ministries or certain religious sects, those can be used year to year. And those exemption certificate numbers that they used last year, they can use this year. If they had an affordability or a hardship exemption from last year, they're going to have to reapply for an exemption for 2015. So those are based on a certain time period when, like, the federally recognized tribes and the religious sects, those can be used from year to year. So you want to kind of look at the ECN number and where that falls. So the process for requesting a hardship exemption, this is, again, with the written application. We've just updated our applications this year, and they're posted to healthcare.gov as well as to marketplace.cms.gov. And we've updated the PDF so that it's completely fillable, and it helps to reduce some of the errors before you have to print it out and write on it and turn it in. And this helps you make sure that the errors will be reduced and that folks are able to turn in the correct form. On the hardship exemption, there's a list of the certain exemptions that fall under hardship, whether it be bankruptcy, loss, if you had an eviction notice, if your water was turned off, whatever it is, and it'll tell you what documents you need to submit with that. We do request that we receive copies of the documents. For example, if you filed bankruptcy documents or had a water shut off, just make a copy of that and send that along with the application. And then we will, on the application, you will actually say what month you were impacted by the hardship. So if you filed bankruptcy, it could be the entire year that you were impacted by this. If you had a water shut off, it could just be a certain amount of months. And when you put that in there, then the marketplace will go and determine how long your exemption is good for. So when you receive that exemption, it will tell you. So this kind of allows the consumer to have the application, all the supporting documents, and mail those in. And so with one last thought with these is that it normally takes about 1 to 2 weeks to process by the time we mail it and turn it around. We're in pretty good shape right now in terms of our processing, so we're not backlogged or anything like that. If you have folks who need to submit an exemption, please do. We heard, last year that some folks chose to pay the fee over the exemption, but the fee increased this year, so folks might not want to do that. So you really want to be able to help walk folks through exemptions, especially if they qualify for one. The next slide is something that y'all might not know about, but we want to make sure that the consumers know all of their options. And that's that if they have applied for a hardship exemption and get the hardship exemption, then they might qualify for a catastrophic health plan. And these catastrophic health plans are, they're not a full health plan, but they do have certain pieces that are similar. So they're very high deductible. They do have low premiums. Medical costs will be covered up to the annual limit, and it does include 3 primary care visits, and it protects the consumer from high out-of-pocket costs. But it's not like a regular plan, but it is lower cost. Normally those are for folks who are 30 and under, but they're also for individuals who qualify for a hardship exemption. So if you have somebody that qualifies for a hardship exemption, they can apply for the catastrophic coverage and still end up with health coverage for the year along with their hardship exemption, just in case something were to happen to them. So we just wanted to make sure y'all knew about that option. So processing the exemptions, again, it's going to vary based off of the application and the documents. So if everything's submitted correctly, all the supporting documents there, it's been copied clear, they don't need anything else, then you should get the written response from the marketplace in 2 to 4 weeks, mainly on the 2 side. It starts taking about 4 weeks or longer when they have to have additional research and go back and forth to get additional documents. So really make sure that those have been completed correctly. And then you'll get the exemption certificate number once you hear back from the marketplace, and you'll use that to put on your tax return. So we've created an exemption screener tool. So if you have folks who come in and you're not sure if they qualify for an exemption, and maybe they don't want to look at a chart, and you can say, okay, well, why don't we go online to healthcare.gov and see if you qualify for an exemption. They don't have to start an account. This is just a screener tool. They can go in and put just a little bit of information about through the screener. You'll first get started, do a few questions, and it'll let them know which ones they should apply for. This isn't going to tell them necessarily if they qualify for, but it will give them the right direction and say this is the one you can apply for. And then once that's the case, it'll link you to the application itself. You can print it and go from there, but this is a great tool we have. So that covers our exemptions. The last piece is the fee. So again, if you didn't have minimal essential coverage, you don't qualify for an exemption, then you're going to have to pay the fee in 2015. So if you look at our next slide, the fee is going to be based on the consumer's household income and how many months they didn't have health insurance. So the higher the household income, generally, and the more months they're uninsured, the higher the fee is going to be. This next slide it actually shows you what the fees are going to be. So for 2015, it increased. Last year, you might remember it being $95, and that amount might be stuck in consumers' heads. So you might be getting some questions this tax filing season about the fee increase. It did go up to $325 per person, plus $162.50 for each child. And a maximum family penalty would be $975 for 2015. So you can have some pretty large fees this year compared to last year. The thing to remember is that it's 2% of the income or this $325 amount. So it could be more than that, depending on what 2% of their income is. So consumers might be shocked this year for that. Unfortunately, we don't have a special enrollment period for taxes this year like we did last year. So we will, if they have to pay the fee, they're going to have to pay the fee and then wait until the next open enrollment period to enroll in coverage for 2016, unless they qualify for a special enrollment, another special enrollment period this year, and we'll talk a little bit about that. It's also a good time where if someone pays the fee now, you might want to give them a heads up or remind them that next year the fee increases again. And for 2016, the fee is $695 per person, or 2.5%. So that's going to increase substantially. So make sure that you are letting them know about that. However, this is based on a 12-month period. So suppose they had health insurance for 6 months, but not the other 6 months. The consumer's health insurance is the fee is based off of those months. So it might be 1/12 of the annual payment, for example, if they didn't have health insurance for every month. They didn't have coverage. They didn't have minimal essential coverage. And just as a note, consumers are considered to have minimal essential coverage for the entire month as long as they enrolled in are entitled to receive the benefits under the plan for at least 1 day in the month. So if they were covered for 1 day in the month, they're considered covered for that month. So keep that in mind when you're processing the tax returns for this year. So I'm going to go over some tools for you, and we've updated some of our tools this year, not only the exemption screener tool, but some of the other ones, and just wanted to kind of give you all some resources and tools. The first one is on our tax tool. So you might remember our tax tool from last year. What we did this year was we streamlined our tax tool process. So you have one entry point, and you'll be able to choose 2014 or 2015 to go through. And then you'll be able to, from there, go forward and see if you want to use it for the second lowest cost silver plan, or to figure out the lowest cost bronze plan. And this is going to help certain consumers figure out the affordability exemptions for the premium tax credit, and also information that might not appear on a 1095A. They can go to the tax tool and get that information. So if you go to the next slide, this is the available information. If they need the second lowest cost silver plan, a consumer would use this if they didn't take or qualify for the advanced premium tax credit, or to see if they qualify for the premium tax credit or need some additional information. They'll use this tool. And then the second tool, path, will take you to the lowest cost bronze plan, and that will help you determine if you qualify for an exemption. So last year the language was a little confusing. We heard from some of the VITA sites, and so this year we tried to streamline that, especially for the exemption piece, making sure consumers and the tax preparers knew which one to use and be able to make that a little more user-friendly. So we heard y'all, and that's been updated for this year. So just as a reminder, and when people ask, unfortunately, at this point, the open enrollment is closed. It closed on January 31st of this year, but we do not know quite yet when the next open enrollment will be. There's a proposed rule out which would have the open enrollment be the same dates as last year, but that's not been finalized yet. So once that's finalized, we'll make sure y'all get the dates for the next open enrollment. But because this open enrollment's closed, somebody might be able to enroll in a special enrollment period, also known as an SEP. And then if they're a federally recognized Indian tribe, they can actually apply for health coverage once per month, so pretty much all year. If you have somebody who's eligible for Medicaid or CHIP, that's all year as well. So Medicaid CHIP coverage, they can apply at any point. And if you're helping consumers who have a small business, the SHOP, which is the small business marketplace, it's also year-round. Looking at the special enrollment period, and you can enroll or be eligible for an SEP if you have a qualifying life event. Some of those are marriage, birth, adoption, foster care. If you have a divorce or a legal separation, and there's some other ones, kind of intricate ones. I talked about the failure to reconcile one before. So it could be that someone qualifies for a special enrollment period and they just don't know. So you want to make sure to check with individuals on that. Most SEPs, they last for 60 days from the date of the life event, 30 days in the small business marketplace. So I showed you this next screen right here is what you currently will see if you go to healthcare.gov and you click on the button that says, would you like to see if you qualify for health insurance? It pulls open our special enrollment screener tool, and that's what we have up here. So you can actually go to the healthcare.gov, enter your zip code, and then a few bits of information, and it will let you know if you qualify for an SEP for this year or not. Again, you're not starting an application, you're not you're not creating an account or anything like that. It's just a simple tool. So it could be at your VITA site, y'all want to have a computer up and running that you're able to access some of these screener tools we have up, such as the tax tool, the exemption screener tool, or the SEP tool, and that way consumers can see if any of those apply to them or help them. I also want to take just one moment to plug the next slide here. These are our coverage to care materials, and these are going to be for folks who are in the marketplace or really anybody who has health insurance. These are materials that we have created at CMS as a roadmap to have health care, understand health care, use your health care. So there's been a lot of research going on the first 2 years of open enrollment as folks are using their marketplace coverage. Who's using it? What are they using it for? Are they going to a doctor? Are they not? So we want to make sure that if folks have health insurance, that they're going to a primary care, that they have help finding a primary care physician, that they are getting their preventative services like flu shots and other things. So this is materials you can order for free. There's a roadmap plus standalone one-page templates. We also have DVDs that you can order for free and kind of run it in your waiting rooms if you want something like that. But this is also a good plug, just as if you're talking to folks or to have in the waiting room of the VITA site area. It's what we like to call health insurance literacy. So we have the health insurance literacy piece from Coverage to Care. We encourage y'all to share that. We have lots of more information online, and as we get some more webinars about this and how to work with your consumers, we'll share that information with y'all as well. So the text resources I wanted to share with you, if you have questions, of course, healthcare.gov taxes, that's really for our individuals. So when individuals have questions about their taxes, they can go to healthcare.gov/taxes. We also have marketplace.cms.gov. Again, that's marketplace.cms.gov, and that has all of our resources. When you go to that website, on the left-hand side, there is a section that says Spotlight Tax Resources, and if you click on that, you can find PowerPoint. We have more in-depth PowerPoints on 1095As, on what assisters need to do with taxes, and on the exemption process in application. So we have some more in-depth pieces. We have some drop-in articles, and we have some fact sheets. And a lot of that is you could actually order and keep at your VITA sites if you want. And we also encourage folks to keep the Marketplace call center number on hand. So if consumers do have questions, they can call the Marketplace call center. And then we also encourage you to contact the IRS for IRS-specific questions. Some questions are going to be for CMS, and some of them are going to be for IRS, but we definitely have questions. If you have questions about the 8962 or 8965, to call the IRS or go to their website. And then we have the kind of a quick resources here and links that would be applicable to most of the tax situations that you might run into with the Affordable Care Act. So our 1095A instructions, which we have online. We also have on the Marketplace, we have those translated. We have the 1095A sample forms and cover letters, and we also have them available in Spanish to help out consumers. Form 8962s on the IRS, the Affordable Care provisions from the IRS are there, tax facts about the Affordable Care Act and about the fees. Those links are available there. And then the last slide has our exemption tool link, again, in case you need that, and then go into healthcare.gov for the screener, and then specific information to the IRS about the 8962, that PDF link is up there as well. So that's all the information that I wanted to share with you all today, and I wanted to be able to leave time for questions and answers, just so I know that there are a lot. I will be honest, I can only answer questions that pertain to CMS, so if we get a question and it really belongs to the IRS, I can copy it down and take it to my colleagues at IRS, but I'm only going to be answering questions pertaining to CMS. So I don't know if we have any questions that have come in.
Great. No, I haven't actually seen questions that have come in, but we will give you a moment to try to type those into either the Q&A box or the chat window. What I have seen are a couple of questions about getting these materials, so I did want to remind everybody that both the recording of today's event as well as these slides, which has all these links in there, will be posted on the partnership's website tomorrow, so you will be able to access this again later. I'm not seeing any others come in, so while we give people one last little second there to try to sneak any in, or did you have any closing words or parting?
No, we just want to say, thank you all for doing the work you do. We want to make sure that when consumers come in, they're really understanding what to do with their 1095As, what that reconciliation is, making sure that their income is estimated correctly so that they don't have to, owe money back, that you're reminding them to update their applications, their accounts throughout the year, and that they are thinking ahead in terms of next year, especially for those who have exemptions or who are paying the fee, so that they can plan ahead to get coverage for the following year.
All right, great. Well, I think that shall do it for this afternoon. Thank you for your time and attention, and we'll see you on another webinar soon. Thank you, everyone.
Thank you.